some of these things. And I think it was great that the summit took place because a lot of things came out as a result of that. And that there was a hands-on approach, I think, is even a greater thing. But will we see now the requisite action? Because the problem that we're seeing here is, with this particular strike, primarily is at the counties, and the representatives were there. What is it going to take for a CBA 9 years old to then be effective so that people can go back to work?
Thank you, Ndu. And I think we must give credit where it's due, as you have said. The summit is a good thing. And I think it was clear from its objective that the main summit was supposed to communicate about the government reforms in healthcare. So that is what they were doing. But we also had the presidential town halls, which now are discussing the salient issues that are affecting we as the health workers. And I'm saying we must give credit where it's due, because this is the first president we are seeing sitting with Kenyans, with unions, with everybody in the same room, and saying, can we discuss these things? And it was a very good opportunity for a SWOT analysis of our healthcare. And I think we discussed, especially during the second one, we had a very great opportunity to discuss about these issues. We have immediate challenges, and we have challenges that will require a long-term solution. And I think the president directed on some of the immediate solutions. He said within 1 week, they should have resolved the issue of the UHC. By the way, that is a very simple issue, because it's only the letters pending. They're being paid at the rates of SRC. Their pay slips reflect the PNP status. It's just a letter. So, and he said, if after 1 week the governors will not have given the letters, then the letters will be given by the ministry. If that happens, that issue will be resolved. On the issue of the strike for both the nurses and ourselves, he also said that he was going to convene the governors so that they can see a way out of that. But then we have some long-term solution that we need. And you know, and as I said then in that town hall, we have seen bold and deliberate reforms. I think how it's working, it depends on who you're asking. And we have seen on the side of financing, we have seen SHA, we have seen FIF that ensures that facilities have money to be able to restock. When it comes to SHA, if you go to level 4 to 6, you will not have a problem. But where we're having an issue is at the primary healthcare level. And the problem is because it's funded by the exchequer, and the exchequer has not been able to fund it to where it's supposed to be. I think the actuaries were expecting around 50 billion. I think the highest we have done in this budget is 19.1 billion.
Hold.
Yes.
So where you, as Kenyans, have paid, or it has been deducted from you, the services are working. Let's simplify that, isn't it?
Yes.
Where the money is supposed to come from government directly, exchequer, is where it is not working, primary healthcare.
Yes.
All right.
And so, and I had an opportunity to speak with Dr. Ishenga of RUFA, and he was informing me that the PHC fund has not paid, I think, since April. So we must acknowledge that there is a problem, and probably Parliament going forward needs to see how to improve on the PHC fund, because it's funded by the exchequer, so that it doesn't then take the money that we are contributing that is supposed to be for level 4 to 6. So on the financing, there are reforms. Are they working? It depends on yourself as a person, and also the level that you're going to. At some point, I had a relative who has had now 3 heart surgeries in a period of 30 years. The other one was in 2017, and NHIF then gave us around 450,000. The other one was last year, actually this year, sorry. And SHA gave us 950, which was an increment of 500,000. So if you ask my family based on that, SHA is working. We got 500,000 more.
Well,
So, but you can see that is the shift. It is between the level 4 and 6.
Where Kenyans are paying.
Yes, and that's why I'm saying that financing is sorted. When it comes to supply of medicines, it's sorted. KEMSA is now supplying more than 91%. Yeah. When it comes to the issue of information and technology, the DHA, when it comes to the equipment, we have that arrangement.